back. This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with Dr. William Taylor from False Creek Healthcare Center joining us in studio today, talking about, among other things, the urology program at False Creek Healthcare Center. Now, Dr. Taylor, I think I'm guilty of something here at this point of the program because we're right in the middle of Movember. We've been taking advantage of your specialty, or your urologist, so we've been talking about prostate cancer and men's issues. But clearly, this is only half of the population, so let's expand our conversation. One thing that just before we leave the whole subject matter of prostate cancer is because you say that most men are going to experience some prostate difficulties of one description or another in their lives. Only a very tiny percentage of us are going to be adversely affected, but a lot of us are going to have to live with something called an enlarged prostate. What's that? I mean, it sounds pretty self-evident, but could you give us a quick description?
Let me just tell you what a prostate is. It's a little gland that is donut-shaped, and it sits at the neck of the bladder. As you get older, this gland continues to grow, and it crimps the urethra, or the tube that comes out of the bladder. So it ends up with patients complaining of a poor stream. They cannot empty their bladder. They get frequency. They have to get up at night to go to the bathroom. They may wet their pants. They may get bladder infections, and they may even completely plug up. So in the past, when we didn't live that long, it wasn't so much of a problem. But now that we're living into our late 70s, 80s, and even 90s, more and more men need attention to this gland.
Okay.
Initially, we have patients who start to experience some of the symptoms, and mostly we treat this conservatively. We have some medications which can help the flow of urine. They may be successful for quite a few years and be without much in the way of side effects. But as the gland continues to grow, something surgical usually needs to be done. Traditionally, we've done something called a TUPR, which means we scrape out some of this tissue with an instrument, and it provides a very good result in most urologists' hands. Sometimes there may be other factors that the result is not as good as we like, but most patients will really benefit from this. Now, over the past 10, 15 years, there have been alternatives to the standard TUPR. Initially, there was something called the green light laser, which was nice. It vaporized the prostate tissue. And there are other sort of laser techniques, one of which is called the plasma button, which we use at False Creek.
Okay.
Now, don't get me wrong, these are probably no better than a standard TUPR. They're perhaps a little less invasive. There's virtually no blood loss with them, and most of the patients can go home on the same day of surgery, but the ultimate result will be equivalent to a TUPR, which has been around for a long period of time. TUPR may need patients to stay in hospital overnight, which is expensive, so that these newer forms of surgery are sometimes a little more efficient.
Right, kind of a day surgery approach.
That's right.
Just
Yeah.
keeping the cost down.
Yeah.
Now, and this is probably a silly question, but you've heard sillier, I guarantee it. If men have prostate cancer issues, is there a female equivalent?
No, they don't have a prostate.
But in terms of you were talking about urinary tract infections and those sorts of things, how does that manifest itself differently in women?
Women tend to have more urinary infections than men do, just because the tube from the bladder is much shorter than in men. As they get older, they don't have any obstruction like men do from their prostates.
Okay.
So nothing really else would affect them like a prostate does. Yeah.
So what then would, now we've discussed at fair length here some of the major issues facing men these days from a urologist's perspective. Give us a list of a similar list of those issues that face women. We're probably more familiar with what you're about to tell us than we are about men's issues.
Right, and there's somewhat of a social stigma in terms of urinary incontinence. And the old English saying is that I laughed until I peed my pants is very true. We're finding that a lot of women, their kids grow up and they get into their 40s and 50s. They want to become more active, doing exercises and things, and find that they can't do this because they're leaking urine. If you're not active, it doesn't matter. You can wear a small pad and nobody really notices. But if it starts to limit your lifestyle, then something needs to be done about it.
Right.
There are some conservative treatments such as Kegel exercises and physio, but they're not particularly successful. In the past, we did bladder suspensions, which initially was an open surgery with a 5 or 6 inch cut. And more recently, that is since the mid-90s, we've developed the urethral slings as a treatment for incontinence. These are much less invasive than the open surgery. They can often be done as daycare procedures, and the patients can return to work within a day or two after the surgery. Now, in the last year or two, there's been a lot of publicity about these slings and surgical mesh. Mesh is what is used to correct the incontinence. It's the same stuff used for hernia repairs, and there are hundreds of thousands of these done every year. And mesh is basically polypropylene or something like something synthetic. Occasionally we use biological products. Now, the most recent slings that we are using are very small. They inserted very quickly. The operating time is less than about 15 minutes. And most of these can now be removed without difficulty. The bottom line is the success rate with them, and 80% of women will be very satisfied with the results if you go out to about 7 or 8 years after the procedure. They are happy with the operation.
Right, and it can be done in an outpatient format.
They're all done as outpatients these days. And we have a couple of female urologists at False Creek that are very good at doing these. One should definitely go to somebody who's very familiar with these procedures and does a lot of them.
Right. Do most women prefer a female doctor, given their choice?
I think so. A lot of women like to go to women,
right.
And we respect that decision. A lot of men prefer to go to men.
Right.
And a lot of people these days just don't really mind, as long as somebody good is caring for them.
Absolutely. Now, also on the staff at False Creek Healthcare Center, you have people who specialize in children.
Yes, one of our urologists
pediatric issues
is a pediatric urologist, and she is especially good at dealing with children.
When children have these issues, because we've been talking about now men's and women's urology issues, but from a perspective of basically boomers or certainly grown-ups, how do these issues differ with children?
Children, often they will suffer from bedwetting, sometimes urinary infections, congenital abnormalities, and sometimes things that need to be corrected surgically before they reach adulthood. So
you have children patients at False Creek Healthcare Center as well?
Not a large amount, but we offer that service as well.
Right. So typically from how does it work? If suppose now listening to the broadcast today, whether male or female, relating to some of the things that you're saying, and perhaps maybe Dr. Taylor looking for that all-important second opinion, the one that you said just moments ago is every patient's right, and in many cases really the ticket to peace of mind for a lot of us. So is False Creek Healthcare Center that place? That's where we go for the second opinion? 110 doctors. There's got to be somebody in there who's got time for me.
Well, we try to screen our physicians to being experts in their field, and some of them are world experts. And so we hope we can offer that service in an unbiased fashion to all our patients that come along.
Right. And is that the reason a lot of people come? They're just, I'm interested in a second opinion. Not that I don't trust my doctor. I just would like a second opinion.
At times, patients are shortchanged. They don't have enough time with their specialist to discuss their cancer. And they need to sit down for 30, 45 minutes and just answer all the questions.
Right.
And we have the time to do that at False Creek. And basically our consultation finishes when the patients have stopped asking questions.
Right. Well, I think you're talking about a limited amount of time available between the patient and the specialist, Dr. Taylor. I think that applies equally to the patient and his or her GP. I think if you, and I know you do this because you've been around for a while, but I think you would find probably a typical doctor's visit in British Columbia lasts maybe 15 minutes, maybe 15. you can't get a lot done in 15 minutes. You're going to go with the issue. I'm here today because I have this wrong. But you don't get a lot of time to just talk about wellness and those things. And that's what you do insist upon taking at Falls Creek Healthcare Center.
We do. We spend as much time as is needed and that the patients demand to resolve their problems as well as we can.
Now, you are a specialist and have been one of those people who have, now that you're at Falls Creek Healthcare Center, time is your friend. But when you were running Richmond General Hospital and had your patients to see and all the rest of it, time is in many ways the enemy of the system, isn't it?
It is. One is fighting the clock all the time. There's a large amount of patients to see. The operating room's calling. Maybe the emergency room is calling with the patient. So you have all these other demands on your time. You try and give the patient as good a service as you can.
Of course.
But at some of the times, the patients do get shortchanged. It's just we run out of time.
Absolutely. So again, if you're in the boat listening to us right now and going, well, I like my doctor and I think she's terrific, but gosh, we barely know each other, even though I've seen her 20 times in the last 10 years, because it's always in and out. Because that's what you see a waiting room full of people, you know that you really can't take much more time. But if you want to take time and you want to sit down with someone who will take whatever time is required to satisfy your questions and to investigate your medical issues, the folks at Falls Creek Healthcare Center are just there for that precise reason, Dr. Taylor, yes?
Yes, we are.
And 110 of you, no less.
Maybe a few more.
We'll take a quick break. This is Boomer Life here on CIL 650. Back with more with Dr. William Taylor after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.